Hello everyone. Today we will discuss about fundus. So what is the normal structure of the fundus? So visualization of the fundus is very important in many situations, especially when we are examining second cranial nerve and when we are suspecting raised intracranial pressure or any optic neuritis, etc. So it is very important to know the normal structure. So we'll deal with this today. As we can see here, this picture is depictive of right-sided fundus. So suppose if we consider this as right side and this will be left one. So this is right eye fundus and this side will be left side. So here mainly two structures are important. One is optic disc. So this is the optic disc and this is macula, that is central fovea. So we can label it. This is optic disc, whereas this structure is fovea or central macula. Okay, so we will discuss what is the difference between these two important things. So as we can see here, optic disc is located nasally. So in between these two eyes, if we consider nose, so optic disc is a nasal structure, that is medial. Whereas fovea is located inferior to optic disc and little bit laterally. So it is infero-lateral structure. So this is one point. Then this optic disc will look pale. When we look for the fundus, it will be pale. Whereas the fovea will appear yellowish. Fovea is the structure in the retina where retinal layers are very much thin. That's why whatever the underlying pigments will be there, that will give yellowish color to the fovea. And optic disc, the margins will be very sharp normally. Optic disc margins will be sharp, whereas fovea will have blurred margins. This is the third difference. Then optic disc is the structure from where optic nerve will begin. And this is the structure where central retinal artery will enter and it will divide into superior and inferior division, as we can see in the picture. So central retinal, this is central retinal artery enters and divide here. Whereas fovea is a avascular structure. Fovea is avascular, whereas fovea has highest number of cones. That's why the visual acuity will be highest at fovea. So we can consider highest visual acuity. Whereas optic disc at this part, we consider it as a blind spot because there are no rods and cones at this particular structure. So these are few important things which we have to know when we are looking at a normal fundus. Thank you.